Hey guys, today I'll be talking to you about knee prosthesis. So a bit of a background here. Knee prosthesis started in the late 19th and the early 20th century. The interposition arthroplasty was attempted using soft tissue. In the 1860s, Werner proposed interposition arthroplasty, which involved the insertion of soft tissue to reconstruct the joint surfaces. Now, a lot of different materials are used for this procedure. Pig bladder, nylon, femoral sheath, anterior bursa of the knee, cellophane, etc. But the results are always disappointing. The use of metallic interposition arthroplasty began in the late 1930s. Now, there are two types of knee prosthesis, the fixed bearing prosthesis and the mobile bearing prosthesis. The design of the mobile bearing prosthesis consists of a rotational polyethylene sheet which sits between the femoral and the tibial component of the knee, both which are made of cobalt, cranium, or titanium. This design reduces the stress on knee by self-correction if alignment occurs. The femoral and tibial components also have a locking mechanism. Now, this locking mechanism sits between the insert and the tibial tray, which not only reduces stress, but also reduces the polyethylene wear. Now, the fixed bearing prosthesis has a lot of issues, one of them being the polyethylene wear, which comes from poor locking mechanisms. Now I'll be talking to you about the cost and the safety of this procedure. This is a safe procedure as joint infections only occur in fewer than 2% of patients. Blood clots can also be a problem, which is normally common in all orthopedic procedures, but blood thinners are used to overcome this issue. Now, this procedure has a high success rate. Lots of these knee prostheses last well over a decade. These knee prostheses have been used in younger people due to osteoarthritis or any other degenerative knee conditions. 85% of these knee prostheses still work after 20 years. Most of the people that go through this surgery are between the ages of 50 to 80, with the average age being 70. And 60% of the recipients are female. Now, the cost of this surgery, the out-of-pocket cost for this knee replacement surgery is $2,499 in New South Wales, $1,609 in Victoria, and $397 in South Australia on average. Now, with ethical issues, knee prosthesis does not consist of any ethical issues. In conclusion, this knee prosthesis surgery is a really successful surgery, and the most common knee prosthesis that's used is the mobile bearing prosthesis. Thank you for listening.